Most physicians assume this is something that you can't avoid. It just happens with old folks in the hospital. The notion is you can actually do something about it to prevent it, to manage it. It actually works.
Delirium affects up to 50% of all hospitalized patients. It costs the country $164 billion a year. And there's over 25 ICD-10 codes for the coding and diagnosis of delirium. And in our country, only 3% of delirium is coded appropriately.
What is wrong with you?
Before the Delirium Management Program, delirium was increasing in the hospital, and the severity was also increasing.
My dad was brought here for his hip fracture, and when he went into the hospital, he was okay, but he became very confused, especially after the surgery. He became somewhat violent, kicking and biting nurses, yelling and screaming.
You're welcome to spend the night with her.
The Delirium Management Program is a psychiatrist as well as a clinical nurse specialist who round every day on a set of patients who have been identified as actively delirious. We have partnerships with social work and pharmacy to help support the work that we do with these patients on a day-to-day basis.
Are you comfortable?
The program encompasses various tools in Health Connect that help with communication among the care team. And also the program has an educational component where hospitalists and bedside nurses learn about delirium and also delirium superimposed upon dementia.
Do this.
The delivery of care to our patients has really become proactive instead of reactive. Identifying it early and managing these patients more effectively so that their symptoms are lessened, their length of stay is shortened, and their complications are fewer.
I'm just going to put this sensor on your fourth finger.
In addition, it's empowered the nurses, the doctors to manage these patients, to know what delirium is, and to take care of it and feel good talking to patients and their families about it, to feel like they know what to do in these crisis situations.
I think we can get you out of here. From 2010 to 2012, we found that we were able to decrease the length of stay for elderly patients with delirium from 8.5 days to 6.5 days. We have hospitals in Northern California that have adapted what we've had in various forms to fit their facility.
This work has been extremely influential in some of the other programs. We have adopted the things that we understand about how to reduce the likelihood that patients will develop delirium following surgery. And I think it's allowed our patients to have a much better experience.
I have endless photographs of him in here laughing and joking, and that lightened the load tremendously for me and for him.
An analysis of the risk factors.
Focusing in on delirium as one of the major morbidity and mortality issues with elder care in the hospital, we were really able to make a difference in this care, and that's what drives me to do this work.
Are you a relative?
It has been extraordinarily rewarding, both professionally and personally, to help change the course of suffering in the delirious patient population.
Clay and Wendy saw a need. They saw that our patients were suffering, and they committed their time and their expertise and their hard work to make this happen.
When they first approached me about this idea, I'll be very honest, I had doubts that this is something that would be successful. But they persisted, and I think they have shown that with a team approach, with avoiding certain medications, with working with families, with changing the environment, you can make a difference.